Hey everyone, this is me Pranav Pinar and you watch me on my channel Pain Se Gain Tak. So today I'm here with a very super duper video dedicated to all the female audience out here, because today I'm going to discuss one of the most common problem faced by 90 to 95% of the females out here, and that is dysmenorrhea, that is painful periods or painful menstruation. So today I'm going to discuss 10 super duper trick on how you can curb down your dysmenorrhea or your painful periods or painful menstruation. So for more details, watch my entire video. So what are the causes of this dysmenorrhea or painful periods or painful menstruation? So when we're looking out, we can see that in 90 to 95% of the females out here, this dysmenorrhea or the painful periods occur due to a normal physiological process. That is, during menstruation, prostaglandins are released from the surface or from the uterine wall. So this prostaglandins actually contracts the uterus or squeezes the uterus like that of a lemon, so that the entire amount of blood and the materials present inside the uterus gets squeezed out or gets ejected out of the uterus and will get shed out through the vagina. So this is a very normal physiological process. But abnormal conditions include the usage of contraceptive devices like copper teeth. So we can see that the females who use the copper teeth are associated with dysmenorrhea or painful periods for about 3 to 4 months. And the other pathological conditions like the endometriosis, fibroid, ovarian cysts, etc. are also associated with dysmenorrhea. So there are also pathological causes associated with this dysmenorrhea, that is painful periods or painful menstruation. So the patients who are suffering from endometriosis often come to the clinic with dysmenorrhea. So these patients who are suffering from endometriosis, there are other clinical features like nausea, vomiting, painful sex, heavy bleeding during menstruation will also occur along with this dysmenorrhea. And also the patients who are suffering from fibroids also will come to the clinic with dysmenorrhea. So in these patients, there are clinical symptoms like constipation. There are clinical symptoms like these patients will be having tendency to urinate every time. And then also they are having heavy bleeding, and also they will be presenting with dysmenorrhea. So these are the clinical symptoms associated with endometriosis and also fibroids along with dysmenorrhea. So there are many methods through which you can control your period pain, that is dysmenorrhea, that is the abnormal period pain or abnormal menstrual pain. So the methods include, one is your hot bath. You can take a hot bath or you can apply warmth on the regions where you are feeling pain, that is between your thighs and also on your stomach, on your back and all. Second is you can take some 15 to 20 minutes of slow walking, so light exercises, and also you can do breathing exercises like pranayama, meditation and all, because all these will be actually increasing the oxytocin, serotonin and also increasing the endorphin levels in your body. So all these are happy hormones which actually help to decrease the amount of pain or decrease the intensity of the pain. Then you can actually eat foods rich in vitamin and also the foods rich in magnesium. So the foods rich in magnesium includes the green vegetables, green leafy vegetables like spinach and all, lettuce, then walnuts, nuts and all. So you can also include that, because magnesium is actually proved to decrease your period pain, and also it is very helpful in treating dysmenorrhea. So eating or consuming the magnesium tablets is also proved to be very effective for dysmenorrhea. Also taking cinnamon, because cinnamon is also rich in magnesium, iron, calcium and a lot of vitamins. So cinnamon is also proved to decrease your period pain. Then the next food is your ginger. You can take ginger tea, that is also helpful, so much helpful in controlling your period pain. Then the transcutaneous nerve therapy, that is also helpful in decreasing your period pain. So if you're a person who used to drink alcohol, who used to smoke cigarettes and all, then please avoid it, because all these alcoholism, cigarette smoking, everything will be inducing the pain. Therefore, please stop it, because that can cause dysmenorrhea. So for God's sake, please avoid consuming tablets for curbing your periods pain, because it is very harmful to your body. I know 80 to 90% of the females used to consume tablets for controlling your periods pain, and I know out of that 80 to 90% consume mefenamic acid tablets for controlling your period pain. So if you are a person who needs that, if you are someone who is suffering from abnormally high period pain, then please visit your doctor, and according to the prescription of the doctor, only take the tablet. And that too, if you are in need, take 1 or 2 tablets in the interval of 8 to 12 hours only, because it is very harmful to your body. Please don't take it. Try not to take it, but if you need, go take to consult a doctor, then according to the prescription only you take the tablet.